carpooling in the age of COVID. Health officials in at least 2 states are warning that sharing a ride could increase your chances of catching the virus. ABC's Gio Benitez has ways to cut down your risk if you must ride in a car with other people.
Whether it's getting the kids to practice or school or commuting to work with colleagues, carpooling is a popular option. But is it safe in the time of COVID?
They're shedding virus in their mouth and their nose, and they're speaking and talking. And in a small car, that individual is certainly going to transmit virus to the members of that car.
Experts advise on how to make it less risky. And experts say just lowering the window isn't enough. You also have to mask up. And while wearing a mask is key, there are other ways to cut some risks, like staying in the same carpool cluster.
Your additional contacts lead to potential risk. So if you maintain the same contacts, you will reduce your own risk and the risk of spreading to others.
The CDC also recommends setting the air conditioning or heat in the car on non-recirculation mode. This way, you're bringing fresh air inside the car to dilute any possible virus particles in the air. And make sure to use hand sanitizer or wash your hands after leaving the car. The same guidelines also apply for ride shares. But the CDC adds, when in a ride share, sit as far as possible from the driver, like in the rear seat diagonally across from the driver.
When we think about sort of the ways in which we're preventing transmission, it's not just one or the other. It's a multi-layered strategy.
So again, if you're carpooling, just stick with the same people. Don't mix up the group. And if you decide to drink some water or eat some snacks, listen, it's perfectly acceptable right now not to share. Gio Benitez, ABC News, New York.